Louise Lounder,
Lola Crick, Brenda Gonzalez,
Linda Sharp.
My name is Crystal Benitez, COM 231-221N. The name of my speech is Injuries of the Brain. Have you ever thought what it would be like not to be able to communicate with the people near you? According to Richard Sinelick, MD, RIOSA, each year 1.5 million people suffer from brain injuries, whether mild to severe. In preparation for this speech, I read multiple publications on different types of brain injuries, and I personally suffer from a brain injury. Today I'm going to explore a few research findings on the topic of TBIs and brain aphasia. Some injuries to the brain can be classified as a TBI, traumatic brain injuries. According to the National Institute of Neurological Disorders, TBIs occur when sudden trauma to the head happens, either from a hit on the table or someone falling on concrete. Different brain injuries, TBIs, can either be mild or severe, and depending on the severity of the trauma depending on the classifications is how they will be treated. Mild TBIs are usually just treated with over-the-counter pain medicines and rest. However, if you have a severe TBI, you can be hospitalized, and some of the medications used are antidiuretics, anti-seizure drugs, and coma-inducing drugs to rest the brain and decrease swelling. Now let's take a look at brain aphasia. Aphasia is a disorder that comes by damage to the brain tissue. Most of the time, aphasia is caused by a stroke. And some of the signs are drooping face, not being able to move one side of the arm. And there's not really any medications you can take from it. And most of the time, when someone suffers from aphasia, there's nothing that can be done except for a speech-language pathologist can try to guide people back into using their voice. Now we will take a look at my case of aphasia. I had a stroke in utero, and my brain stopped developing. And as a result of this, whenever I was younger, I stuttered an awful lot. I could not come up with my words, and all through my schooling, I had to see a speech-language pathologist so that I could learn to talk better. I did not know that I suffered from brain aphasia until I had an MRI. And I will show you, ladies, my brain. So you may pass it around and see my brain. Since I was not aware that I had brain aphasia, it never really affected me. Goodbye.
Well, not class, not now. Here's the minute.
Now we have completed the overview of traumatic brain injuries and brain aphasia.
Stop.
In conclusion, many people suffer from brain injuries even though you may not be aware living your daily life. Next time, before you make fun of somebody or try to open the door, realize that people with brain injuries could be doing a speech. Thank you.
Yeah. Very good. Awesome. That was very good.